21. What are the major risk factors associated with cerebrovascular diseases? The risk factors can be divided into non-modifiable factors like age, sex, and family history, and modifiable factors including hypertension, diabetes, cardiac diseases, hypercholesterolemia, and lifestyle choices. 22. Describe the differences between ischemic and hemorrhagic infarctions. Ischemic infarctions involve perfusion failure and can lead to global or focal cerebral ischemia, while hemorrhagic infarctions occur due to the rupture of vessels, resulting in bleeding and additional complications. 23. How does hypertension affect brain circulation and lead to hypertensive cerebrovascular disease? Hypertension causes hyaline arteriolar sclerosis and accelerates atherosclerosis in cerebral vessels, which in chronic cases can impair autoregulatory mechanisms and result in various lesions like massive intracerebral hemorrhage, lacunar infarcts, and slit hemorrhages. 24. Explain the pathological basis and progression of hypertensive brain disease. Hypertensive brain disease involves various lesions like lacunar infarcts, slit hemorrhages, and hypertensive encephalopathy, where microscopic changes include fat-laden macrophages, gliosis, and sometimes petechia and fibrinoid necrosis in terioles. 25. What clinical features are associated with different types of brain infarctions and intracranial hemorrhages? The clinical features depend on the size and site involved in the case of infarctions, and the type and location in the case of intracranial hemorrhages. 26. What are the common causes of brain atrophy and their associated clinical symptoms? Brain atrophy can be caused by various factors such as age-related atrophy, infections, nutritional deficiencies, trauma, neurodegenerative diseases, and drug-induced effects, leading to a range of cognitive, motor, and psychiatric disturbances. 27. What are the major types of intracranial and cerebral hemorrhages and their causative factors? Intracranial hemorrhages include extradural, subdural, subarachnoid, and intracerebral, caused by trauma, hypertension, aneurysms, bleeding disorders, and other factors. 28. What are the different pathologies and clinical manifestations of ischemic infarction? Ischemic infarctions can affect various sites, resulting in different clinical manifestations depending on the size and location, leading to neurological deficits, headaches, seizures, and variable recovery periods. 29. Describe the microscopic and macroscopic changes observed in brain infarctions at different stages. The changes range from early neuronal damage and necrosis to the repair phase and eventual gliosis, with macroscopic changes involving swelling, liquefactive necrosis, and the development of cysts with surrounding scar tissues. 30. Explain the complications associated with brain infarctions and their clinical implications. Complications include neurologic deterioration, neuromuscular dysfunction, cognitive impairment, psychiatric disturbances, and various medical complications, necessitating immediate attention and care to prevent further issues. 31. Define the term lacunar infarcts and describe their pathogenesis and clinical significance. Lacunar infarcts result from occlusion of the penetrating arteries supplying the deep structures of the brain. These small cavitary infarcts, usually a few millimeters in size, can cause significant neurologic impairment depending on their location. 32. Explain the impact of transient ischemic ataxia on the brain and the significance of these attacks. TIAs are brief, temporary episodes of neurologic dysfunction caused by low-flow states due to atherosclerotic narrowing of cerebral arteries or emboli. Although they do not result in permanent brain damage, they indicate severe atherosclerosis and serve as a warning sign for potential future cerebrovascular events. 33. Elaborate on the types and causes of venous infarcts and their clinical implications. Venous infarcts, though uncommon, result from large vein occlusion due to conditions like thrombosis, sepsis, or chronic illness, leading to hemorrhagic outcomes. Depending on the location, they can cause clinical symptoms. 34. Discuss the features of hypertensive encephalopathy and its microscopic findings. Hypertensive encephalopathy is characterized by increased intracranial pressure and global cerebral dysfunction, often presenting with altered consciousness, severe headaches, and sometimes petechiae and fibrinoid necrosis in arterioles when examined microscopically. 35. Explain the differences between extradural, subdural, and subarachnoid hemorrhage, along with their common clinical presentations. Extradural, subdural, and subarachnoid hemorrhages occur in different spaces within the skull, causing varying clinical features. For example, extradural hemorrhages manifest with a lucid interval followed by a decline in consciousness, while subarachnoid hemorrhages often led to sudden headaches, neck stiffness, and altered consciousness. 36. Elucidate the major causes of non-traumatic intracerebral hemorrhage and their clinical implications. Intracerebral hemorrhages can be caused by hypertension, neoplasms, bleeding disorders, vasculitis, aneurysms, or arteriovenous malformations, leading to sudden headaches, raised ICP, residual paralysis, or even death depending on the location and severity of the bleed. 37. Describe the diverse causes of brain atrophy and their associated clinical features. Brain atrophy can stem from various sources such as age-related changes, infections, nutritional deficiencies, trauma, neurodegenerative diseases, and drug-induced effects, leading to an array of cognitive, motor, and psychiatric disturbances. 38. Discuss the importance of a multidisciplinary approach in managing brain atrophy and the primary preventive measures. The management of brain atrophy involves a multidisciplinary approach encompassing different medical specialties, neuroradiologists, nutritionists, physiotherapists, and policymakers. Primary preventive measures aim to avoid the population's exposure to manageable risk factors. 39. Explain the different stages of microscopic and macroscopic changes observed in brain infarctions. The changes progress from early neuronal damage to necrosis, subsequent repair, and eventual gliosis, with macroscopic changes involving swelling, liquefactive necrosis, cyst formation, and scar tissue shrinkage. 40. Enumerate the various complications associated with brain infarctions and their clinical significance. Complications include neurologic deterioration, neuromuscular dysfunction, cognitive impairment, psychiatric disturbances, and medical complications, necessitating immediate attention and care to prevent further issues. If you like this video, please like and subscribe